Hello everyone, welcome to our presentation about the Ortolani test. So it's an orthopedic test used to assess hip joint laxity in dogs. These tests help us to detect early signs of hip dysplasia by checking of abnormal movement of the femoral head inside the acetabulum. So we usually perform this test in the following situation: when a puppy or young dog shows gait abnormalities, in dogs presenting mild lameness, especially after exercise, when animals have difficulty standing up, running, jumping, or climbing stairs, or when hip dysplasia is suspected based on clinical signs or radiographic findings. Whole breed, both large and small, can be affected by hip dysplasia, but it's more common in large and middle-sized dogs like German Shepherd or Samoyed, for example. So for the anatomical review, the hip joint is a spheroidal synovial joint formed by the head of the femur and the acetabulum of the pelvis. It's stabilized by the joint capsule and the ligament of the femoral head and the surrounding muscle groups such as the gluteal, the pectineus, and the iliopsoas muscles. In a normal dog, the femoral head fits snugly inside the acetabulum, allowing stable and pain-free movements. In dogs affected by hip dysplasia, there is a poor coverage of the acetabulum. The femoral head may partially dislocate, and which leads to a degenerative joint disease over time.
So now here we have a photo of an x-ray of what hip dysplasia looks like, which we can see the dislocation of the femoral head. For performing the Ortolani test, place the dog in lateral recumbency on a stable surface. Grasp the stifle and the femur with one hand, keeping the femur parallel to the table. Apply a downward force along the axis of the femur to push the femoral head into the acetabulum, while maintaining pressure slowly above the limb. In a healthy dog, the femoral head remains stable within the acetabulum through the maneuver. No movement or click should be detected. This is considered a negative Ortolani sign.
In a dog with hip dysplasia, you can feel or hear a click as the femoral head relocates into the acetabulum during abduction. Dogs affected by hip dysplasia may exhibit clinical signs such as lameness, pain on manipulation, difficulty standing up, muscle atrophy, and a characteristic bunny hop gait. In conclusion, the Ortolani test is an essential tool for the early detection of hip dysplasia. When performed correctly, it ensures reliable and clinically useful findings, allowing us to reach an appropriate treatment. Now, reaching the end of the video, we would like to thank you for listening and we hope that you found it helpful.